Kids are not mini adults. When your child is sick, it's important to get them the best care from those dedicated to and specializing in caring for kids.
We're so excited to be OSF HealthCare Children's Hospital of Illinois Cancer and Blood Disorders Institute and be opening the next chapter as a children's hospital and continuing our wonderful care that we've provided for the past 40 years. And as we continue to progress and evolve as a children's hospital, we're opening that next phase and expanding our care portfolio, aligning with the overall destination vision and where we're going over the next decade, but in perpetuity, because we're going to be here for multiple generations.
That's Meg Zakreski, president of OSF Children's Hospital of Illinois, and I'm Shelley Dankoff, your host for OSF Healthcare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. There are more than 280 active children's hospitals in the United States. OSF HealthCare Children's Hospital of Illinois is the third largest pediatric hospital in Illinois and the most comprehensive hospital for kids downstate. With 136 beds and more than 140 pediatric subspecialists, OSF HealthCare Children's Hospital of Illinois cares for more children in Illinois than any hospital outside of Chicago. It is important for people to understand what that means and how we care for kids on a daily basis. Joining me to talk about that and much more are Meg Zakreski, the president of OSF Children's Hospital of Illinois, and Dr. Chuck Abrahamian. And I have to read this title because it's a mouthful. Surgeon-in-Chief, OSF Children's Hospital of Illinois, and Managing Medical Director of Pediatrics for OSF St. Francis Medical Center. So thank you both for being with us. Let's start at the beginning. Why is it important for a community to have a children's hospital, and especially a community the size of Peoria?
I think it's a little bit unique for a community the size of Peoria to have a children's hospital. I think oftentimes it's that no matter what your child is going through, it can be cared for locally. I think that's what differentiates a children's hospital from a hospital that just does some pediatrics, that there's not a too sick, too small, too complex.
Yeah, so let's talk about a little bit about what sets Children's Hospital apart. And when I sit here and say that 140 subspecialists, what does that mean and what all do we offer?
We have excellent bench depth in terms of subspecialty care, anything from level 1 trauma within our ED or our surgical services to complex cardiovascular surgery to brain surgery, and of course our Cancer and Blood Disorders Institute for the full scope of cancer and hematologic care, our tiniest babies in our NICU and our small baby unit. So anything that you need for your child is right here in Peoria, right here in your backyard.
And I think to your point, there's a certain comfort level, isn't there? We serve a pretty rural population in some parts of our coverage area. Children's Hospital serves, 35 counties?
50, it's almost 50 counties.
Almost 50 now up in the state of Illinois. And a number of those have a rural population. And so the thoughts of going to a Chicago or St. Louis or Indianapolis, it's a little scary if you have a child that is sick. Plus we offer Life Flight, OSF Life Flight, a very robust medical air ambulance program as well. So we can get kids here from wherever they are. But how important is that in serving our rural communities to have this resource here?
The interconnectivity between our 17 hospital system and the ability to get children here when they need it or triage them when they're in the rural areas across our 40 subspecialties is vitally important. If we can care for them at home within the healthcare system, we want to do that. But when they need to come here to the level 1 trauma center or for that higher level of care, we want to make sure that we can offer that as well.
Yeah, you talk about the level of trauma centers and even the NICU being a level 4. Those designations mean a lot in your world, don't they? And so tell me about the process just to earn those designations and keep those designations. It's not a process for the faint of heart, is it?
It's not. It's incredibly complex and an investment from OSF HealthCare as an organization and the Children's Hospital with our mission partners and our physicians as well.
Yeah, I think for the neonatology, the American Academy of Pediatrics has had those levels for some time. Illinois will be adopting those levels hopefully over this next 1 to 2 years as they pivot to the most complex with the congenital heart center versus we take care of small babies, but if they need surgery or let alone heart surgery, they can't happen here. So for a level 4 nursery, that's all encompassing for any, age, gestation, or health condition child could stay here. So I think that's very important for parents, maybe who are expecting, if there's ever a diagnosis that they get, they know it can be cared for here locally. I think from a trauma designation, we're state designated. There's 2 designation sort of pathways. There's American College of Surgeons designation as well as state designation. But I think for level 1, it's that, no matter what happens to your child, and accidents, injuries are the leading cause of death in children. And that's, we're fortunate, right? Kids aren't getting a lot of things that we deal with on the adulthood spectrum, but that we have the full complement of anesthesia, surgery, surgical subspecialties, ICU care to take care of the children.
Just to run through a few stats for those listening, more than 7,000 inpatient admissions a year, 75,000 outpatient specialty visits. So while we think of the inpatient world, there's a lot of clinics, and we take the clinics to them, which also helps. 2,400 newborn deliveries, 18,000 emergency department visits each year. So to your point, that's a lot of kids coming through the doors that you may not think it happens. And there's a separate entrance. There's a separate everything for the children who are coming in because it's scary. Nobody wants to go to the hospital, let alone come into an emergency department. So it's warm and welcoming. The Sisters of the Third Order of St. Francis, the governing board for OSF HealthCare, started in Germany, caring for orphans. So children have always held a special place in their heart. That means sometimes they've done things that maybe other organizations will say, I'm not so sure we should do that. That where we look at it is what's best for the children that come to our doors. There have been times where perhaps you've as a surgeon, made special requests and gone to them, and they've said yes. Tell me about some of those and what that means to you as a surgeon.
I think it's twofold. Number one, it's always to take care of the children. I mean, from Sister Judith Ann telling us that directly, that it's okay, God will provide. You do the right thing for the children, the right things will happen for us. And they put their sort of pocketbook exactly in line with that. We had a complex patient, and we offer a specialized program here called diaphragm pacing. So if a child has a spinal cord injury, the pacer actually stimulates the breathing muscle to breathe for them. So we've avoided some tracheostomy tubes and being on the vent with that. And there was a child in a terrible accident. So this was a trauma patient that had a spinal cord injury that in their recovery, the time to sort of rehabilitate would have required a tracheostomy. In adults, it may not have, but in children and the way they breathe and their smaller muscles, a little bit weaker, she would have required it. And so we had the idea to do that. And going through insurance, and it was going to be not possible. And the sisters talked to Illinois Medicaid and said, what if we just take care of it? Will you take care of the rest of the care, but we'll take care of that. And it was I didn't really necessarily ask that directly, but it was offered that, yep, you can still offer anything you'd offer to anybody else, offer to her, we'll take care of her. And that child, because she was a spinal cord injury with kind of a paraplegic, not a quadriplegic, once she rehabilitated, she didn't need the pacer anymore either. So she sort of had this short term in the sort of 3 to 6 month time period, kind of ongoing rehab to her breathing muscle, while she then rehabbed her spinal cord injury and then learned to get stronger and wheelchair and all those things to the point where she didn't need it anymore, and she never had a tracheostomy. So I think that was, yes, I mean, we take it for granted maybe sometimes as physicians and clinicians and nursing staff of where we work, but I think the culture of the sisters, shines through.
Yeah, and you said you didn't even have to make a special ask. It was just like, it's the right thing to do. Mm-hmm. We're going to take care of it. And it's wonderful to hear the child is doing. I mean, it ultimately was what was best for her.
It was best for her.
That is fabulous.
Yeah, we always make the decisions that are in the best interest of the child and the family, regardless of the ability to pay. And that's who we are to our core. We take care of our community, we take care of each other as mission partners, but most importantly, we love what we do. And we're here because we believe in what we do. We believe in the mission and our sisters and that God will provide, and God does. So we're very fortunate for that. We're fortunate to be here in Peoria as well and offer all of this to our community.
Let's talk a little bit about the recent expansion of the Children's Hospital Cancer and Blood Disorders Institute. Why was that expansion necessary? And what does that mean for, again, all the patients that we care for, the broad range of them? Tell me about that.
Yeah, we're so excited to be OSF HealthCare Children's Hospital of Illinois Cancer and Blood Disorders Institute and be opening the next chapter as a children's hospital and continuing our wonderful care that we've provided for the past 40 years. We have physicians that have been here for over 40 years providing oncology and hematology care, the same care team. And as we continue to progress and evolve as a children's hospital, we're opening that next phase and expanding our care portfolio, aligning with the overall destination vision and where we're going over the next decade, but in perpetuity, because we're going to be here for multiple generations.
And again, it's about providing whatever a child needs, whatever type of cancer, or whether it's sickle cell disease or various other ones. It's the program that fits them best, correct? And it's the physicians they've known. And sometimes we collaborate with outside organizations for the best possibility for that child, correct?
Correct. In children's, it's well known that collaboration with each other makes us all better. We learn from each other, and it could be across state lines or internally as well. So we're very fortunate that pediatrics is such a wonderful community. We all care about what we do, and we care about each other. So those collaborations are a core of who we are.
You have an event coming up in the fall. We're not there yet. I love Meg's enthusiasm. Your enthusiasm is it's contagious. And you hit the ground running when you arrived, and we did this event, Paint the Town Gold. And so tell everybody about Paint the Town Gold and what the goal of it is, because it's pretty fun.
So Paint the Town Gold was signed into the congressional record last year. It's a remarkable event for our organization and for the community, acknowledging families that have been impacted by a diagnosis of cancer or hematological disease. And we're so excited to continue the expansion this year. We're lighting the bridge. We're wearing our shirts in solidarity in the community and across our organization, and continuing to share the message because we know that awareness brings advocacy, and that helps kids everywhere.
You both came here from other areas. You're not native to Peoria. You came here from outside of Peoria. What drew you to Children's Hospital of Illinois? Dr. Abrahamian, I'll start with you.
I think the potential, the growth, the vision of, Dr. Rick Pearl recruited me here. I think it was that we had potential as a children's hospital. I'm Midwestern from Wisconsin originally, did my training in the South, and I think the opportunity to build programming, to grow people and teams, to continue to take the most care, best care, most complex care that we could. It's simple. I want to grow programs to take care of how I'd want my kids taken care of and speak to families like I'd want to be spoken to. That's it. If we can control those two things all the time, we'll be fine. And I think the complexities of healthcare, the complexities of day-to-day living, fighting traffic, we measure time in miles here, right? Because we're lucky. We can drive to Kewanee or wherever, Urbana, and come back in a day. That's crosstown Chicago traffic. Right. That's crosstown New York. So I think to have complex medical care with simple living and, philanthropy and Midwest sensibilities, our community is so supportive. I think pitching that to recruits to say, hey, we're growing programming. We want to do more complex work. You're going to have the support administratively of, Meg, myself. And, it's a great place to raise a family, a great place to, be supported locally in our community and philanthropy. It's becoming easier to recruit here, not harder.
I echo all of the things that Dr. Abrahamian mentioned, but, being a part of OSF Healthcare and Children's Hospital of Illinois, it's just different. We don't just talk about our mission, we live it every day. We see our patients in our schools, in our churches, and at the grocery store. So we're truly a community, but we're family here. And our family is a part of that community as well. And where we are going as a children's hospital, we're in growth mode. We have had a record recruitment season. We're expanding. We're adding a pediatric specialty care center for ease of access of care in a We Were Expecting You experience. And we're continuing down that trajectory across OSF Healthcare with Destination OSF, across Cancer Institute, our Neurological Institute, and our Cardiovascular Institute. So now is the time to be a part of OSF and continue on this amazing journey.
You touched on philanthropy. Philanthropy is a big part of what we do, too. And Children's Hospital has benefited tremendously from some wonderful gifts. I want to give you a chance to talk a little bit about the Heller Center for Kids, because talk about a beautiful gift that has done some remarkable things. Talk about that for a little bit.
We're so fortunate to have John and Annette Heller and everyone that has been a part of Heller Center for Kids with Cancer. We expanded it into Heller Center for Kids at Children's Hospital of Illinois this last year to offer impact across the entire Children's Hospital for wraparound and support services, from physical therapy to music therapy to supportive integration with social work or psychology. So just really thankful to have those services for children. We know that the diagnosis or their experiences impact them while they're at the hospital, but at home too, and going back to school and going back within the community. And Heller touches every part of our organization. So we're really thankful for that expansion.
Yeah, we get the kids better, but there's still lifelong things that a number of them deal with. It's not as simple as, you mentioned the young lady who was, partially paralyzed, just paralyzed, but having to recover from that and learning new ways of doing things. Mm-hmm. So sometimes you need other resources. It isn't just about the care you gave her as an inpatient, but even post. So it's nice to have those connections, isn't it?
Completely agree. And it's lifelong. But the most important thing is that they're kids first. So that's what makes us different in pediatrics, is they're children first, and their medical diagnosis is a part of who they are, but having that pediatric experience with the wraparound services and being a children's hospital is that differentiator.
Okay, my last question to both of you. What is your hope that when people hear OSF Children's Hospital of Illinois, what is it you hope they think of when they hear those words? Meg, I'll start with you.
When you hear OSF HealthCare Children's Hospital of Illinois, I want you to know that we're here for you 24/7. We'll answer the call. We have the talent and the expertise, the research, amazing nurses, and just an amazing organization overall. But most importantly, we care about you and who you are and your family to us. And your children, we care about them as if they were our own.
Yeah, it's that partnership of care, with the family. They aren't just another insert diagnosis or number, as part of any program. They're part of the family, part of the Children's Hospital family. They know their care team. We know them. They're not, little details. I think it's that not too big, right? We have that sensibility, that's that partnership that I think families really appreciate when they meet our care teams. And I think to have the ped subspecialty kind of care center finished and have more clinicians kind of together in multidisciplinary space together, I think you'll really see the team shine, and then the family experiences really, be really, really high, because they'll have that. And they already tell us things like that when they see us and meet our teams. But I think it's that culture of the Children's Hospital that we're really caring for the whole family, not just the kid. And we really want to be, partner with them. They're not just another, patient. And I think that's, if we maintain that, we'll do very well.
And the specialty center opens early 2027?
Yeah, this time next year.
Yeah.
Yep,
Come to our open house. We're ready to see you.
It'll be great. Looking forward to it. Dr. Chuck Abrahamian, Meg Zakreski, thank you for spending some time with us and having this discussion. Always good to see the two of you.
Thank you.
Thank you.
And thank you for joining us as well. And remember, you can find all OSF Healthcare Accelerated podcasts at osfhealthcare.org/accelerated.